Hi there. Welcome to our webinar, Ask the Vet with Dr. Tom Tully. We will be he'll be answering your questions shortly. We'll just give people the time, time to log on. And we're just talking behind the scenes of, so to speak, about hurricanes, because Dr. Tully, you are kind of in Hurricane Alley, right, in Louisiana? A little bit of, can you hear me?
Yes, I can. Yes.
So we were talking about when force of nature of the magnitude that Hurricane Laura, my namesake, unfortunately, it actually is. You have so many things that you take for granted that could go away, like your internet, if you're not hit directly, with a building being blown over, you still have a lot of things that you have to probably deal with, right?
Yeah, I mean, it's something that anybody along the Atlantic. I mean, we had Sandy up in New Jersey, and of course Florida, and then North Carolina isn't spared. I think the Outer Banks is kind of sticks out there, and that's an issue. And of course, all along the Gulf Coast from Brownsville all the way to South Florida. Some areas are more prone than others, and this is always a concern with anybody that has birds, to make sure that they're protected and to be prepared. And you just, the forecasting has been, advanced a great deal, but you still have that cone of uncertainty in the spaghetti plots, and you're going like, well, this one's going way over here and they're all going here, but will it go here, But it's advanced quite a bit. And, the east side's always worse than the west side, significantly worse than the west side. But you have to be prepared, and you should be prepared. And because I was saying we were out of power, we had a storm come through our area. We've had a number of storms, but a significant storm called Gustav back in 2008. And we were out of power for 2 weeks. And that's 14 days. And I was really, that storm gave me a realization on how delicate the life we lead, where we count on electricity to power our phones, to the internet, to live, and so and then also that electricity is important for gas stations, filling stations to work, also for stores to be open. And this is all something that people need to realize if they're in certain parts of the country where this can occur, where you're out of power and communication. So I just think being prepared, and as I always say, don't expect the cavalry to come and save you, because they're not there. Okay, they may get there in a month, they may get there in 6 months, they may get there in 2 weeks. You just don't know. But don't expect people to come in and save you. You have to be prepared to deal with what you have and take care of it for a significant amount of time in the face if you have some of a natural disaster occur. And this not only includes you, but if you have responsibility over animals, they are counting on you to provide for them in this time. And being able to do things on a instantaneous basis is not there. It just there's no electricity. And if you don't have electricity, think about what you can do and what can function. Not much, because we're all relied on that plug-in, and so this can happen just about anywhere due to tornadoes, or all of the naturals, the ice storms in the Northeast I couldn't imagine living in the Northeast knowing that I have an ice storm occur and then not having a generator, because that's life-threatening. It's one thing to be without electricity in August or September with heat and humidity, but being in an ice storm where it's below freezing temperatures and you have no electricity, that would just be, you have to look at a generator just being part of life.
Wow, those are very good points. Well, I hope everyone is, who are hard hit in these areas, whether it's the hurricane or the fires in California. There's a lot going on weather-wise. So I wish everyone, I hope everyone's doing much better today than when it first struck or how they were before, and their birds, of course. Well, Dr. Tully, I think we're going to dive into questions. We got a lot, I'm sure. People have really looking forward to this series that that we host with you. So if you're just joining us, the webinar today is Ask the Vet with Dr. Tom Tully. I'm Laura Dorian, your host, and I have a question for you at the door here, Dr. Tully. So let's get this Q&A started. And as a reminder to our participants, if you have a question, use the Q&A button, not the chat button, but please submit your question on the Q&A, and we can get your question easier that way. Okay, here we go. So this question is about Jack, who's a Nanday conure, unknown age, found lost outside 8 years ago. So they took him to the vet due to him being tired all the time. They found a high uric acid, 17, dropped to 11 after 4 days of fluids. Also elevated WBC. Energy returned, behaviors back to normal. Also testing for lead and zinc, and results of those are pending. He had an x-ray that showed some mineralization in his wing, which the vet said may be from an old injury, but his kidneys look normal. Medication, he is on Cipro 25 milligrams ml and sorry if I'm messing up these names, Betamega. The vet will test again after medication is finished. His diet is 50% pellets from rowdy bush plus nutriberries, pellet berries, and table foods like chicken, egg, fruits, blueberry, blackberries, bananas, apples, sometimes pasta, bread, and fish. So there is your first case there. Let's see what's going on with.
Sounds like a great diet. I'll have some of that myself.
So what can we do? So what's your take on Jack the Nanday here?
Well, the one thing is the owner, I guess, is wondering about possible causes for a high uric acid, and are there any foods to avoid? I don't really see, anything in there to avoid. As we've said on this series, that you always want to try to provide and have the bird on a formulated pelleted diet in some form or fashion, so that the minerals and the vitamins can be consumed, so that they can get to their what we would consider their normal daily requirements for their nutrition. And really, with most of the species, if not, I would say the majority of species, we don't know what their daily minimal requirements are. We know for chickens, for sure, and maybe one or two, I guess, citizen species, but not many. And so, therefore, we have to try to extrapolate from other animals and other birds. So the best thing to do is to provide and make sure they're getting that, as opposed to a single dietary offering. And is there any foods to avoid? As I mentioned, you don't want to overfeed. You want to make sure that the bird is eating. It's not necessarily what you're feeding it, but what it's eating. Because you could feed it all of these things, but if it's only eating blackberries, well, you would feel that over time you'll have some type of nutritional deficiency. And so it's being aware of what the bird is actually eating, and not to kind of, I guess, fall into a habit. Well, it's eating blackberries, so I'm going to feed him more blackberries and less of this. So you want to try to avoid doing that and having the bird dictate what it's going to eat. You don't want to starve the bird naturally, but you want to try to provide a diet that's as diverse as possible, but making sure that it's getting what it needs. As far as avoiding foods, of course, you'll look and you'll hear, and we've talked about avocados. You don't want to feed avocados. You don't want to feed chocolate. I can, there's probably people that are participating that says, well, I fed my bird guacamole. I fed my bird chocolate. It gets some of that as a treat or something, and it's still alive. Well, that's good. I'm not saying that if you feed it that it'll die, but there are compounds within that there may be adverse reactions to feeding that, and that there's no reason to risk any of these adverse reactions with the compounds that may be toxic within avocado or chocolate. And you're saying, well, is it the skin of the avocado? Is it the meat of the avocado? Nobody's going to necessarily feed the seed of the avocado, but nevertheless, it's the compound. You don't want to feed any of that. There's too many other options to feed the birds, and so why risk it? That's my thoughts. So those are the two, I guess, food offerings that you would have that I would say there's no reason to risk that. Now, as far as high uric acid is what we measure as far as a kind of a renal byproduct. It is filtering the kidneys are filtering the blood. And high uric acid can be an indication of dehydration, or it can be another big component of high uric acid could be of kidney failure. In my experience in birds, that when you have a high uric acid and the bird is relatively, I guess, if you would say it's relatively responsive, then what you're looking at is, for the most part, it's dehydrated. If you have a high uric acid, it's dehydrated. And so there's many things that can cause dehydration, but for the most part, that's what the situation is. It could be the bird's just not drinking water. It has not, the water ran out and it didn't have water, or it's not getting enough water availability because another bird's keeping it away from the water. So there's another number of reasons, or just a general environmental temperature and humidity. The heat index is so high that it's affecting the bird's ability to stay hydrated, just like humans. Why we get dehydrated, similar reasons the birds get dehydrated. And so that's why, like I said, if the bird is relatively responsive, it could be sick, it could be lethargic, depressed, what have you, but it's still responsive. Then in like I said, the majority of those cases, it's dehydrated. That's what you're looking at. Now, can birds have a high uric acid due to renal failure or significant renal disease? Yes, they can. In my experience with birds and high uric acid as it would relate to renal disease, if the uric acid is so elevated, or it's elevated due to renal disease, in the majority of those cases, the bird is, if it presents alive, it's relatively non-responsive. and it dies within a day or two. If the kidney disease is that bad that it causes an elevated uric acid, then the bird usually succumbs to that disease within a day or two. So it's extremely rare in my experience to have renal disease of that magnitude cause a high uric acid and the bird's still responsive. You can have significant renal disease and the bird will, you won't have an elevated uric acid just because of the way that the compounds metabolized and the filtration system works with uric acid in birds. And so if the disease where the the kidney cannot effectively cause a excretion of this uric acid, then the bird is in there's the renal function is just too severe. The renal disease is too severe. And the problem we have with birds is trying to determine if the bird has renal disease in light that you don't have a high uric acid. And often in humans and other mammals and animals with bladders, you can actually take a urinary sample and see, and that can tell you how the kidneys function. With birds, guess what? We don't have bladders, okay, in birds. So it's impossible to really determine effectively the renal health, the kidney health in this manner. You say, well, they urinate, and you can get samples, but remember that the urine is contaminated by the fecal material when it comes into the cloaca and out the vent. They urinate and defecate from the same orifice. So that's our problem there. So how can you tell if the kidney is in the what the health of the kidney is, or if renal disease is a factor? The only way that we can really effectively tell that, of course, we can do diagnostic imaging and we can do things like that. But for the kidney itself, it's pretty what I would call significant as far as the diagnostics, because we have to do an endoscopic biopsy, and we have to go in and take a biopsy of that kidney. And these biopsies are relatively small. The kidneys are relatively small, so it's only a specific part of the kidney that we can take biopsies or multiple biopsies of. And what we look for is abnormal tissue. And with this abnormal tissue, we try to biopsy that to look for kidneys. But we've had birds that have come in that have been urinating. They've been drinking water and urinating, and their uric acid is normal. But what they have is they have significant renal disease that may be associated with what we call visceral gout or mineralization of the kidney, and the uric acid levels are normal, but they have significant renal disease. So that's kind of a complicating factor. But when you have high uric acid, the bottom line is, and the bird is somewhat responsive or what have you, then what you're looking at is dehydration, which in this case you can see where the fluid therapy brought that level down, and 17 is elevated. It's not significant, it's not really high elevation. I've seen dehydrated birds come in at 30 to 40 with their uric acid level. This was 17, but it's dropped it down to 11 and had the elevated white blood cell count. white blood cell count, there's many, there's different factors in a white blood cell count. There's, you have your heterophils, you have your lymphocytes, your monocytes, basophils, eosinophils. That's all involved in that white blood cell count. So I don't know how elevated or what of those different cell lines may have been involved, but if you look at if there's an inflammation going on, you'll have a high a heterophil count, and that may explain why the bird was not drinking or dehydrated. It could have had a gastroenteritis, some type of an intestinal problem that was causing diarrhea that may have dehydrated the bird. So the treatment and the fluids appear to help this. So kind of an answer to kind of multiple issues that I think everybody should be aware of, because they're all important, and it's good to have some knowledge of the uric acid and dehydration in birds, and how that may relate to disease concerns, and what we can try to do to assess renal disease, which is limited.
Okay, that was a very good thorough answer there, and a good explanation. Let's see, I have a question from Laureen. She asks, I have a 1-year-old Congo African Grey. I've started a foraging system for him. How much seed and pellets should I be offering each day in addition to fresh veggies and fruit?
I always make sure that with my birds to try to offer as many, what we call ad libitum, or as a bowl of pellets, in the so that the bird always has pellets anytime it eats. Birds, for the most part, as everybody knows, you're not going to put in the food and they'll eat it all at one time. They'll eat a little here, a little there. If you, as far as seed, I would make, I always say have a small percentage of that is seed, as far as just diversity and psychological. The one thing, as I always mention, and some people, as they say, have an adversity to feeding their bird seed, or transitioning to pellets, or getting their bird to eat more pellets. That's where the beauty of the nutriberries or pellet berries come into play, where you can offer this as a foraging diet, and also allow the birds to have more of become they become more familiar with the pellet, and taking the pieces of these the nutriberries or pellet berries apart, and in providing some diversity there. As I've always mentioned about vegetables, I feel are more nutritious than fruit overall. Fruit is it says a treat. It's sugar and water for the most part, and so I would feed more vegetables and fruit. You can again 2 to 3 times a week, depending on how much. If you put fruit and vegetables in there, you're going to have to remove it, because it will spoil quickly, and you surely do not want some type of a bacterial media within the food bowl. And so I would again, depending, it's not well, it's essential to feed fruit and vegetables. If you don't have time to clean it, then that's, you shouldn't do it. They will get enough of the vitamins and minerals through the pellets and the seed that you would, be able to provide them. The fruits and vegetables are, again, diversity. It's good psychologically. It's good to have that, but if you don't have the time to clean and make sure that that's fresh in there, then I think that there's more harm than good by doing that and providing it on that.
Okay. So I have a question from Kelsey. She asks, I have an almost 19-year-old African Grey, Timneh African Grey. He has malformed mucous membranes, and I have to clean his nares out daily, sometimes more than once a day. When we got him, he had 3 different infections, but once we got those cleared, he has been infection-free for 13 years. I would just like some more information on the malformed mucous membrane problem.
Well, as far as as far as what you're kind of describing, this is the nares and the area within the nares, within African Greys in particular. You said, I think it was a Timneh African Grey.
Yes.
But this happens in Congos too, where they can develop bacterial infections and or fungal infections within that area. Now, what happens is that they get formed kind of like the tissue is reactive within the nares itself inside, and that's where all of this infection is. And so when you look in those nares, now there in many birds and gray in African, they'll have an opercular bone. So there's a bone in there that's not abnormal. But what happens is these infections occur and it irritates that tissue, you'll have tissue buildup in there, and that it'll actually expand that tissue and deform that tissue, okay? And that is something that needs to be removed. I've actually, and when you have this, and it's kind of termed like atrophic rhinitis, which is where it atrophies and deforms the tissue within the nares. So you need to actually get any of that buildup out of there, and the nares itself, after you remove this like big scab out of the nares, yeah, it's gross, you know, but medicine sometimes is that the nose opening may be permanently deformed, okay? Now, we culture that and we try to determine, and as this question states, it, I think that they've identified some organisms there. Now, what I always say with the cases that we have that come in with this condition is that this is not something that will be resolved quickly, okay? And it's going to take aggressive therapy, and it's going to take time, okay? Because the infiltration and the environment that these organisms live in as they infiltrate this tissue, it is difficult to treat, okay? So what we're looking at is a kind of a long-term treatment. The nares, the nasal openings, may not get back to normal. There has been some disruption in the normal protective barriers there. We have had and seen it so severe in some African Greys where the nasal septum is actually has been dissolved, and so you could go from one nares to the next with some type of an instrument. So it can get really severe. And so if it's fungal, it needs to be treated with an antifungal. If it's bacteria, it needs to be treated with an antibiotic. But the antibiotic needs to be sensitive to the organisms that are associated with the disease condition. And there's multiple bacteria that can cause it. Aspergillosis, aspergillus, a fungus, is the most common fungus that occurs here. But as African Greys are exquisitely susceptible to aspergillosis in the lower airways and the lungs and the air sacs in particular, they're also susceptible to aspergillosis in the nares. So with this African Grey, it's not an uncommon disease condition, but knowing that it takes aggressive therapy, the proper therapy, and that it usually occurs over a period of time, that's what needs to be acknowledged and known, because it can be treated, but it may reoccur, and it has to just be maintained.
Okay, I have next question from Cece. Is there any link or document you can point us to that is a checklist of diagnostic tests that we should run on our birds yearly? Thank you.
No, because I think it's just dependent upon the bird's clinical history, and how that and then the veterinary clinic and the standards of care for that veterinary clinic. So there's not a list, but I can tell you, as I always mention, when you bring the bird in to get a physical exam, you're definitely a yearly annual health checkup. It's to determine what that is, and a complete physical exam. And so when you give the bird a physical exam, you're looking externally. You're looking at everything from the tip of the beak to the tip of the tail. So that's what you're looking at. Now, as far as the internal part of the exam, that's where we're looking at where you do diagnostic blood testing. Now, if anybody brings in an animal and a bird for a yearly physical exam and just think that, well, we're just going to do a physical exam on it externally, well, that would be like you going to your physician and saying, I'm here for my checkup, physical exam. And the clinician, the physician looks at you and goes, oh, check you, does an auscultation, feels around. Oh, you look good. Looks good to me. You're all healthy. Well, that's not the case, because they usually have, well, here's, you got to go get some blood drawn, and here's the lab instructions for you to go and get that, so we can do a CBC and whatever other diagnostic tests to see what's going on inside. That's the same way, veterinarians aren't magic, more magic than a physician is in being able to determine externally what's going on with the animal, more than a physician can do with you when you go in for an annual checkup. So I would say that diagnostic blood work is important. Complete blood count at the very least, and possibly a chemistry panel if that's the I couldn't argue with that if that's the policy of the clinic.
Okay. Next question is from Jennifer. First of all, thank you for your time, doctor. What are your best tips and tricks for converting a very picky blue-fronted Amazon from junk pellets / dried fruits to fresh veggies and nutritious pellets?
Yeah, that's kind of that's a good question. It's difficult to do simply because it's you know, as I mentioned, you don't want to starve the bird by any stretch of the imagination, but I would say that you would want to initially try to work with food offerings that the bird would like, or you feel like would be most likable, and start start specifically. And I've said before on this that in many of these cases, you know, birds have individual tastes as much as anything. I learned that early on, and so what one bird's going to like, one blue front Amazon, and what another one is going to like is going to be totally different. And so you try to offer small amounts, always small, to see what the bird will eat initially when you're looking to provide, and if you want to provide fresh offerings to them, vegetables, fruit, what have you, and then go with that, and then that would be a start on how you could maybe kind of work the bird into a more you know, diversity within that area. Some things that you may offer, and because what you're doing is you're kind of saying, well, if I like it, you'll like it. This tastes good, you know, but some things you're going to offer the bird will never eat, you know, just like, you know, there's birds that will never eat a pellet. Okay. I don't care what you do. And so you have to just work with the bird and do what you can to make it happen. You know, and so you say, well, what if a bird never eats a pellet? Well, then that's where, you know, you use something like I said, that's what the beauty of like a nutriberry is, or a pellet berry, where there's seed into the food offering, and that it will allow the bird to have to go through, and what you're looking at is the possibility of that bird eating some of that pellet as it's eating the seed that's within that berry. And so that's kind of operant conditioning, where you're having the bird think it knows what it's doing, but you're kind of controlling that, you know. Oh yeah, you're doing what you want to do, but you're getting some pellets in there whether you know it or not, and I'm not telling you. All right.
It's kind of like sneaking in the veggies with your kids.
Yeah, exactly.
Put a little kale in their smoothie, and
Yeah. Don't tell them, and so yeah.
All right. Next question is from Richard. Richard says they have two 9-year-old lovebirds we have had since they were chicks. A boy is friendly. Girl has been aggressive since being 1 year old. Girl now holds the wings low at the sides and is a poor flyer. Blood test shows no problems. Any ideas?
And so the one thing, you know, I'm just thinking as far as it's a poor flyer, you're saying, and it's been aggressive, and it holds the wings to the side. You know, when you're looking at something like this, and if I had the bird come in, you know, those are what we consider non-specific clinical signs. Okay. I'm just not feeling well. I just don't have the energy that I once had. I just feel I'm tired all the time. And so I can tell you, and I always say this, and it's something for you to think about, when you're, have a case like this with one of your birds, is to think about, if you had somewhat similar signs and you went to a physician, what would you think that the physician would do? Okay. And so, if you have something like the bird's holding its wings down because there may be a large mass, well, that's obvious. It could be a tumor, or it could be some type of a fracture, or if there's not feeling well and the bird has nasal discharge and has difficulty breathing, then it could be a respiratory infection. So then that's fairly obvious. When you just have something that that would lead you toward a possible diagnosis, say, I think it could be a respiratory infection. It may not be, it could be, secondary signs, something like that. But when you have what we call non-specific clinical signs, such as this, birds just not feeling well, then what you need to do, there's a multitude of things that could be there, and nothing more than any other at this point. So that's where you would have to start looking inside the bird, where you would need to make sure that that you could assess what's the blood work look like, the diagnostic blood testing look like. That may be give you an indication that something is and pinpoint you toward a more obvious path toward diagnosis.
Yeah. Well, they said that the blood work showed no problems. Is that something to retest then, or?
Well, I mean, that's always a possibility, because sometimes what you have is you have disease conditions that are affecting the bird's general condition, but the body has not responded to those specific disease conditions. And also what you look at is what's the general, as far as the bird itself, the weight. Always look at the you have the bird's attitude, you have the bird's wings are kind of drooping, it's not flying like it used to. Again, we're not talking about, I think it's 11-year-old lovebird or something like that.
9 years.
9 years old. So we're not talking about a real young lovebird, but not one that's overly geriatric. But so those are the factors. Then, is there anything else that's abnormal about the bird? As far as its behavior, disposition, and what's its body condition? Is it thin? Is it overly thin? And then also, as far as its eating habits, is it eating? Is it maintaining its weight, which goes to body condition? And then also, is the stool relatively normal for what it is? And I always say that, always kind of make sure that you're kind of aware of what the normal stool looks like, and so that you can look at abnormal conditions on that. If the blood work is normal, then what we look at is we try to do the diagnostic test. It's not like the animal comes in and it's not like, well, we need to do Oh, let's see, a complete blood count. We need to do a plasma chemistry panel. Oh, let's do a tox screen. Oh, while we're at it, let's do radiology, CT, MRI. You know, that's not the way it should work. It should work based on the diagnostic test, based on what the condition of the animal is in, okay? And what we feel is the problem going on, to do the minimal amount of tests to get the maximum amount of information, okay? So we want to get the diagnosis with the minimal amount of tests and assess the patient's general condition. So when you have just a lethargic bird, or one that's not as active as it has been, then also when you have physical issues, and then you have behavioral issues also. Now, I don't know, you know, you always have to consider that. You look and see if there's anything medically wrong with the bird, where it could be a disease condition, but there's also behavior that could be involved with this, and exactly why that is. So there are further tests that can be done to assess this bird, but and then also, as I said, there could also be conditions. We, you know, had a bird that ended up having lymphoma and had disease conditions. The bird was not acting right. It was not doing right. It had other disease conditions also, but nothing that would say that this bird had lymphoma, okay, a cancer. And it just took some time for, you know, we did the blood test, we did blood tests, we did all of these diagnostic tests, but we could not make the diagnosis definitively, because the disease had not actually affected the bird to the point where we could pick it up on the diagnostic. So sometimes this takes a little bit longer than we would like to try to make the diagnosis, but that's unfortunately sometimes how diseases work, in particular cancers, where it's fooling the body itself to think that the cells are normal. And so that's why you don't have a positive response. Not saying that that's what the condition is here. It could even be behavioral if you have everything's normal on the case. So it's something to continue to watch and to see if there could be some kind of a behavioral issue that's affecting the bird, but also monitoring body weight, monitoring the condition of the animal, and then seeing if there's anything other, you know, abnormal going on.
Okay. Next question is from Susan. She asked, how do I clip my African Grey parrot's claws without clipping into a blood vessel?
Clip them very, 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 very short. That's the only way. That's the only, what's that? That, I mean,
is that I mean, without cutting into the quick, you know, so that
yeah, very short, because it's a claw. It's a claw, and if you have let's see if I can draw real quick here. Okay.
Gotcha.
You know, this is for those who are here, and to show the normal claw of a bird, and then also I'm drawing right now to show the vascularity, because you have the tissue, and so And so can you see this?
Oh, wow. That was an amazing drawing in that short period of time.
Okay. So if you look at this, the covering of the claw, it's not a nail, it's a claw. And so the covering, underneath the covering, it has the vascularity to give the nourishment to the claw. So if you look and you say, well, what is the normal claw and as far as trimming it? Well, we usually look at to do a job to trim it to a level that is of significance, is to trim it at about the level of the bottom of the foot when the claw's in a normal position. Okay, so that's why we use a Dremel tool to do this, and that's why we provide Medicam after we do it to provide some pain relief to the bird for 24 hours. And that's why in some birds will, depending on the bird, especially the larger birds, we sedate the birds before we do it. It's not anesthetize, we just give them some sedative so that they're not, so that it kind of takes the edge off. But so if you see this and you say, well, how can I trim my bird's claws to not bleed? You cut them very short, right here, very, very short. Now, if you took them to me and I did that, then you would say, I want my money back because you didn't do anything. Okay, because you can't see much. And so we'll have claws that come in that look like this. Okay, and so if I trim right here, it's not doing any good, right? As far as, I call it macro Velcro, where it'll catch it and then it could rip the claw right from the foot. So this is a this is what we're looking at. I have had people be successful using emery boards and training their bird and just keeping the edge off, and it never bleeds. There are birds where we just don't, that there isn't a need to trim the claws. There are people that have delicate skin and the birds come out and their little claws become talons and it just rips up their arms, so they need to be trimmed. And we have also other birds that grow their claws, cockatoos and some macaws, that their claws go all the way around in a setting, and you can have and as I've mentioned, I don't the perches with cement and to try to keep the claw short. When you're looking at the claw, that is if you're looking at when a bird perches, the majority of the tissue or the foot on the perch is the bottom of the foot, and the claw is really, it's just a very tip actually on there. So it may help with the tip, but it doesn't do much, and it also causes irritation to the bottom of the foot. So regular branches and that helps, and then some birds you don't have to trim them, others you do, but to trim it where it doesn't bleed, you need to do it very short.
And probably more consistency, frequently, right? If it's going to be little trims.
Yeah, and do that and see how that works. And
Now,
if,
just you can actually see the part of the nail, depending on if your bird has light colored nails, or you can kind of see that live vein in there. Is that right?
no, not
No?
in birds. I would say, you know, possibly, you know, I'm thinking of an Amazon, maybe, maybe a little budgie you could, but it's hard, Laura, it's hard to see it. And, you know, in certain Amazons, say maybe, I'm thinking a double yellowhead or something that may have a kind of a light claw, you know.
Okay. Claw, not nail. All right, I have a question. Let's see. Patricia states, this is not a health issue, but if you could help, it would be greatly appreciated. I have two Timneh African Grey birds. Both cages are open when I'm home. One will not stay on off the top of the cabinets, and she is chewing them. I make her get down and tell her bad or no. To reach her, I have to use a large plastic spoon, and she knows, because when I come with the spoon, she gets down off the cabinet, and she knows, but will not stop. I tried having her wings clipped, but she still can get on top of the cabinets. I have heard of putting birds in a timeout, but I do not wish to be using, used to putting her back in the cage as a timeout. Any suggestions? That's from Patricia.
Any suggestions? The one thing that I am always concerned about when you put a bird in timeout, that they may be training you to put them in timeout, and they may like that, and that I think is kind of something that you have to consider. Not that it's necessarily out of the picture to do that, because what you're looking to do is to try to reward and reward the bird for good behavior, and try to go down that path as opposed to any type of punishment, or somewhat of a going down whatever you want to call that. And so I would say my thoughts would be to try not to have the bird get on the cabinets, okay? And you're going, well, that's the question, Dr. Tully. That's what I don't want. And so I don't want that. And so what I guess I'm saying here is that whenever the bird's not on the cabinet top, to reward it. And then when it's rewarded not being on the cabinet, you're training it to say, if I'm up there, I'm not going to get what I want. Okay, there's no reason to have any animal destroy your property, and one, because it's just not good to do, for a number of reasons. Number two, anytime, and we have treated birds that have destroyed, like cabinetry, and cabinetry is kind of manufactured in a way that I think that there's more tendency for splinters and things of this nature to kind of penetrate the bird than, say, if they can chew up, you know, thousands of perches and never have a problem, regular wood perches, but give them kind of finished cabinets and it splinters, and it's somehow that it's manufactured. And then there's some cabinets that are held together with glues and stuff like that that just aren't any good. So that's another reason not to do it. But you don't want them destroying your house. And so reward, I would say, try to look at rewarding the bird more with something that you don't provide often, and that you say, this is the special treat, and that it's only used when the bird is doing some, not on that cabinet. And I think that this is, and as with any behavioral training, that there will be, it takes time. It takes time. So you're gonna maybe go 2 steps forward, 1 step back, but it's just like treating that nasal problem with the African Grey. You want to keep going in a more positive direction, and that over time, this should be more on what you're looking for than the problem. And so that's the one consideration that you're looking at when you're trying to reduce problematic behavior and go more toward a what you want the bird to do.
Great. So like positive reinforcement kind of goes a bit.
Oh, that's the secret. That's the secret. That's what the animal who doesn't have rational thinking is going to respond to. It's not going to respond to anything negative. It's going to respond only to positive, because that's what stimulates that bird. It's not negative reinforcement or punishment. The bird is not going to respond to that, okay? Because it can't rationalize that. And it can dictate how it responds to that. And grays and birds in general can become really can kind of neurologic. I mean, can become a kind of a psychotic type situation if you punish in where they just respond adversely to even you getting around them, and there's no reason to risk that with something that's going to be uniformly ineffective. And so the animals respond to positive. I don't care if it's a chimpanzee or a human. They're going to respond in, more effectively to positive reinforcement. But when you're talking about dolphins, when you're talking about elephants, when you're talking about, overall, the quality of that interaction that you have, and the, I guess, relationship you have with that animal is going to be through that positive reinforcement.
Okay, and on that note, I believe we are out of time for questions today. If we didn't get to your question today, we will send you an email reply. So if you put your question in the Q&A feature, we can send you an email with an answer. Dr. Tully, that was another amazing episode, and we might have to do some drawing with Dr. Tully next time, because that was a really good impromptu drawing of the claw on the foot. So,
well, there you go. And
you might be diagnosed, but we might need some more visuals like that of our next time we do.
A picture's worth 1,000 words, Laura. And I try to do that with the.
All right. So next time, have your paper and pad next to you.
There you go. But thank you, and I want to thank everybody in Lafeber and yourself for such a wonderful webinar. Thank you.
Well, great. Well, we hope to have you back soon. Just let our audience know that we're going to be off the next couple Fridays, but we'll be back, I believe, on September the 18th with Dr. Stephanie Lamb, and the topic is going to be safety first. So stay tuned for that one. We'll have that featured in our newsletter when we have that coming up relatively soon. We're almost in September here. So again, thank you, Dr. Tully. Everyone who joined us today, thank you so much. Until the next time, everyone stay safe and all the best to you and your flock.
And healthy. Yeah, bye.